Welcome to today's International Medical Physics Week webinars. Today is the third episode of this series on healthcare sustainability in low middle income countries. We started on Monday with the sustainable by design. We look at environmental sustainability and what we can do, and then followed by the role of medical physicists in promoting this environmental sustainable practices. And logically leads to today, we will hear from three speakers representing Asia, Africa, and Latin America. And coincidentally, today is the Earth Day, so we should do our part beside profession, save energy, to conserve water, to reduce waste, and to green the earth. So it is timely. We will find out what our speakers have to say about their practices, the struggles in the respective continents, countries. And now I shall pass it to my co-moderator, Professor Yong, to continue to introduce the speakers, and we start the webinar. Over to you.
We have Dr. Iyobosa, who is the current president of the Nigerian Association of Medical Physicists. She is also the secretary of the Society Clinical Training and Certification Board. She is the chair of the Professional Development Committee of FAMPO. And she is also a member of the IOMP Women's Subcommittee. She is board certified by the International Medical Physics Certification Board, IMPCB. Currently, she is a lecturer at the Department of Radiation Biology, Radiotherapy, and Radiodiagnosis of the University of Lagos, as well as a visiting consultant at the National Youth Hospital. She is a director of the ALMP Hamilton School for Medical Physics, and previously she was the head of medical physics at the University College Hospital in Ibadan. And she received the prestigious IPAM LMIC Medal Awardee. And we will now move to our third speaker, who is Dr. Iyobosa, who will share her experience from the African perspective. Dr. Iyobosa, over to you.
Thank you, and good day, everyone. Thanks to the IOMP for the invitation. I would just like to state a disclaimer that Africa is not a continent where you have a one-size-shoe-fits-all. There's a little variation from one country to another. So the views that may be expressed in this talk may or may not represent the entire situation in the country. If I may summarize my talk today, it will be about the what, why, and how of sustainable healthcare in Africa. So just like the previous speakers had spoken, if you compare the talks from 2 days ago, a lot of talk about greenhouse, CO2, environmental sustainability. That is not really a major concern for us in the region. It's more about building systems that can, withstand economic shifts, maintain quality care without total dependence on external expertise, external aids. So in other words, building systems that are affordable, healthcare systems that are affordable, accessible, and uninterrupted. Something happened during the COVID-19. COVID-19, the pandemic exposed how weak the African healthcare system is, and even the workforce. Sorry. And the reason why this subject of healthcare sustainability is important is because Africa is the future. There's a lot to unpack here, but we don't have time for that. I'll start by comparing, I always like to compare Africa with China and India because the population is very similar. So we can see that similar population, and we can see the difference in the number of medical physicists on the continent and even equipment like the linear accelerator. And if you take the two largest countries in Africa, Nigeria and Ethiopia, and compare with the two largest countries in North America, Canada and United States of America, the population are comparable. We can also again see the difference in the number of medical physicists in these two countries compared to what you have in Canada and America. It's not all bad news. Despite all these problems, there's been significant expansion in some countries in the region in the last 5 years, like in Nigeria. We used to have about 3 linear accelerators 5 years ago, 6 years ago. Now, this morning, I was able to count about 21 linear accelerators, 2 PET CTs, 4 SPEC CTs. In Kenya, too, they also had a similar situation with us in Nigeria. They had about very few LINACs, but today they have about 20 LINACs. They even have a cyber knife. And then Tanzania, too. Tanzania is also expanding. But there's a different scenario in some other parts of Africa, like in Sierra Leone. Sierra Leone has just 3 medical physicists and no machines have been installed yet. Sudan, the 8th largest in the continent, has about 30 medical, used to have about 30, now they have about 15 because of the war. So most of the oncology centers have been shut down and they just have one that is functioning. And you have over 100 medical physics graduates that are, with most of them that do not have jobs. Ethiopia has just, the 2nd largest in the continent, just has about 11 medical physicists, no graduate program. And they also have expanded from having just 1 telecobot to 5 LINACs. And Zimbabwe, 7 medical physicists, and they are installing about 4 linear accelerators now. So you can see there's a whole difference. We move across the region. And the IUMP's last report showed that, I mean, apart from Ghana and South Africa, that was able to make it up on the graph, most of Africa is in this region. If you're comparing the population, the number of medical physicists to the population, and I like to call it the 60-60-60 problem. So you have 60% of the population of medical physicists concentrated in about 3 or 4 countries in Africa, and 60% of the workforce are in radiotherapy, and 60% of the equipment we have in the entire region are also concentrated in about 3 or 4 countries in Africa. There's a problem with the workforce, obviously. We cannot talk about sustainability in healthcare because it depends on the workforce. The strength of the healthcare system depends on the strength of the skilled workforce. So medical physicists, of course, like other professionals, are suffering. Most of our medical physicists are moving to UK, America, because for better recognition, validation, better pay, and so on. And we're not just losing the numbers, the quality of medical physicists living is also a problem. We are all having inter and intra-migration. So even within the continent, they are moving from, so we're now having an increase in private hospitals coming up. So we have medical physicists moving from government hospitals to private hospitals that are paying better. And that is also causing a disparity in the quality of healthcare in urban and rural areas. The state of healthcare in Africa is a cause for concern, and that's why sustainability is a very important issue. Africa bears 25% of the global disease burden, and we still import 90% of our drugs. Apart from cancer, I know there's a lot of attention on cancer, but malaria is the leading cause of death in Africa. Diabetes, cardiovascular disease, HIV, stroke, dementia, kidney diseases, vision impairment, hearing loss, and we have a very young population. Sorry, my screen is not moving. Okay, it's moving. So our population is increasing and our systems are getting weaker. And we have the youngest population globally with a median age of 19.7 years. So you see there's a problem. If we're going to have a sustainable healthcare, we need to be alive to be able to sustain the system. We have the resources. Africa is blessed. We are wealthy. We have the resources. We have the brain, the intelligence, but it's wasting. I'm not a bearer of bad news. And I would like to say that it's an opportunity for us. It's an opportunity for us in Africa, for medical physicists in Africa, because inherently we have been trained, we have the skill sets, to resolve these challenges, these problems, as scientists. But first, we need to break out of the container. For example, I was saying that, almost everyone is in radiotherapy, talking about cancer, and there are other diseases that are killing us in the region. So we need to break out of that container that we have put ourselves in. The definition of a medical physicist is one who applies the principles of physics in medicine to treat and diagnose diseases, not just in radiation medicine, all aspects of medicine. So I like to see us as superheroes. And as a superhero, when there's a problem, you show up, you solve the problem. You are not going to say that it's only this kind of problem you can solve. So as medical physicists, we need to remind ourselves of who we are, break out of the container we have put ourselves in, and start to look into these other areas. You might ask, why am I talking about this, considering that we don't even have a lot of medical physicists in the continent? But there was something one of the speakers said yesterday. Dr. Diana, I screenshot this from my presentation, that we already have the skill set. We can translate that same skill set to developing solutions and with same passion. And I give an example of Sudan again. I'm bringing up Sudan again. Sudan is the 8th largest country in the continent. There used to be about 30 medical physicists and now 15. Because of the war, no oncology centers for them to work. But I was asking my colleague, do you have hospitals? You have a lot of hospitals that are still functioning. So what happens to the medical physics graduates that are there sitting down without jobs? What is happening? Shouldn't you be applying as a physicist, shouldn't you be applying your physics skills in medicine? The same, we also have the same situation in Nigeria. There are a lot of medical physics graduates that are there without jobs because everybody's waiting to work in radiotherapy or nuclear medicine or in radiology. And there are many other countries in Africa that do not even have radiotherapy equipment at all. But do they have hospitals? Yes. Do we have physicists that are graduating every year? A lot of physicists, yes. COVID-19, like I mentioned earlier, was a blessing in disguise. It got me thinking. During COVID-19, there was lockdown. No AIDS, the expertise that we're all depending on could not travel. Sorry, the power has been interrupted. It will come back soon. So we couldn't get the experts. And all of a sudden, we saw countries like South Africa, Nigeria, Kenya, Ghana building ventilators that were not existing in the hospitals. All of a sudden, scientists and engineers, physicists, we are all building ventilators. So I was like, oh, so we have the skills. We can do this. We can build equipment. We can build low-cost equipment that are deployable in rural areas that can make healthcare cheap and affordable. So what were we doing all this while? We need to transfer that same energy. In fact, a lot of students, masters and PhD were doing their projects related to COVID-19. Everybody was writing software, why can't we channel that same energy that we used during COVID-19 to solve the problem of cancer and other diseases that are plaguing the continent? And something else also happened using my country as an example. The policymakers, the leaders, they don't even know what medical physicists do. When equipment are purchased, we are not carried along, and they always call external experts, to do what needs to be done. And during COVID, no external expert was able to fly in. They had to rely on the local experts, medical physicists within the country who have been there all along, to commission several brachytherapy machines that were just lying down, doing nothing, and even linear accelerators. So we have the expertise, we have the brains, we have the wherewithal, but we have not just been using them. COVID-19 also opened the doors to a lot of global collaborations. There's no time to start to talk about every one of these organizations that are partnered with different African countries, either as regionally or single as a country. But the question I ask, and I want us to think, is this enough? These collaborations, is it enough? Will it be enough in the years to come? Are they sustainable? How can we as medical physicists sustain the profession and ensure that high-tech treatments of today are still safe, available, and affordable for the patients of tomorrow, for our young population that is increasing? I'm going to suggest a few strategies. Like I gave an example of the COVID-19 situation where physicists and engineers were building ventilators. Why are we not building, fabricating local tools, using available materials that will be cheap and, affordable, reduce operational costs, and also help to develop local capacity? Our research we are under the pressure of trying to meet up with the Western world, with the developed world. We want to publish papers that they can read, and we are leaving our problems here. We need to start to convert our researches to commercialize them, set up research labs, startups, share resources, and think about projects that are actually solving local problems, not projects that are going to make you noticed by the international community, for lack of a better way of putting it. Another example again, during even before and after the COVID-19, I have colleagues, even some in Ghana, in Lagos, in Nigeria, who are developing or who fabricate, local phantoms for a fraction of the cost, about 10% of what it would cost us, if we're buying maybe from the manufacturers or depending on external donation or support. So, like I said, we have the skill set. We just need to use them, to develop tools that will make healthcare affordable. And because we are scientists, we are physicists, we can verify the science. The impression that most people have, I think, is that if you're fabricating stuff locally, it's not going to be as standard as, no, the science is the same. And that's our job as physicists, to ensure that it is safe before it is deployed for clinical use and verify the science behind it. Another strategy is, so I was talking about developing projects, trying to think, come out of the box, think outside of the box, and start to apply our physics, beyond radiation medicine and to all other aspects of medicine. But we are heavily dependent on the IEA. So I'm using this opportunity to make a case for the need for our curriculum to be reviewed. I'm saying this because in Nigeria, we are already aware of these issues. And for the past 6 years, we have been intentionally trying to change that and create more awareness of physics in all aspects of medicine, because and that's why we collaborated with institutions like IMPW in the UK, because there are a lot of physicists there who are working in several areas of medicine that are not even common in places like Africa, or even in some North America. Everybody seems to be in just in radiotherapy. This will help to reduce brain drain, because most people that leave the country are not just leaving because they want more money. It's not, everything is not about money. People want fulfillment. People want defined career paths. People want to see that they are relevant. So by the time we start to diversify our science, I believe this will reduce brain drain significantly. And again, if we're talking about building sustainable healthcare, we need to ensure that the physicists are competent. So rather than sitting and waiting for government recognition on all the other challenges that are facing us in the region, for example, in Nigeria, we have developed our own certification board in collaboration with the Australian College of Physical Sciences and the IMPCB, so that we can raise competent medical physicists. Another strategy is advocacy. We need to sell our craft. We need to talk about what we do. People don't know what we do. People don't know who we are. We need to make noise about what we do, so that they can know that the superheroes are available to solve the problems you are going outside to find people to come and solve. They are there with us, but they don't know. Most of them are just ignorant, and we need to continue to advocate for our science and our relevance. And this would help to bring in funding so that we can start to build labs, manufacture, equipment, and all these other things that can help to sustain healthcare. And medical physicists also need to start looking to going into positions of influence, because there are policymakers, clueless people that are sitting in these positions of power that don't even know what it's about. So I like, there's a colleague in Kenya who is currently running for Senate. He wants to be a senator in Kenya. And I was like, that's good. We can have medical physicists as senators, as governors. I mean, that would really, really help the profession. And then, what about philanthropy, entrepreneurship? There's a hospital in Cameroon, the Cameroon Oncology Center, that was built by a medical physicist. A medical physicist single-handedly built this hospital. And it is the only cancer center in Cameroon that has a linear accelerator. They're about to installing the second one. It's a full-fledged oncology center with nuclear medicine and diagnostic facilities, done by a medical physicist. So what exactly are we saying? There are a lot of opportunities for us as medical physicists to show what we are made of and contribute significantly to healthcare sustainability in the region. Of course, we're in the era of AI. I'm going to round off with this. We're in the era of AI. I feel like the whole world knows what's going on except us. We are sleeping on gold mines. Our data is even being exported. This is another opportunity for us to cover lost grounds. I always tell colleagues, I don't think we need to pursue any system. The developed world has gone way ahead. Africa, we need to focus and solve our issues. But AI is an opportunity for us to cover lost grounds. And it's an opportunity for us to create jobs, more jobs for physicists in the region. It's an opportunity for us to enhance resource allocation, extend quality healthcare to rural, undeserved areas, tailor solutions to local needs. If anybody is looking for whatever it is they need to do, those graduates that do not have jobs, please, I think you need to start looking in the direction of AI. AI is one tool that Africa can use to improve healthcare significantly. And it's a gold mine. We have the data. So finally, I would say that healthcare sustainability in Africa should be looking towards health sovereignty. We should be looking towards developing African-led research and development, manufacturing, and so and so and so. Sustainable solutions require building local capacity rather than creating long-term dependency on external assistance. It is not sustainable at all. The good thing is that physics, that's one thing I love about physics. Physics is principles, founded on principles and laws. They are the same everywhere. It is just how it is applied that makes a difference. And we need to actually start applying this physics and this science locally to solve problems. So thank you. I want to acknowledge all the wonderful physicists in Nigeria and all of Africa. I want to say that you're simply the best, and we need to start to see ourselves as so. We need to start to see ourselves as the heroes that we truly are. And I want to use the opportunity to invite everyone. NAMP, Nigerian Association of Medical Physicists, will be turning 40 this year. It's our 40th anniversary. So we're inviting everyone to Abuja. Come, let us talk, let us rub minds on how we can sustain healthcare in the region. And for the first time in Africa, we are collaborating with the International Medical Physics Certification Board. For the first time in the region, we'll be hosting the IMPCB exams in Abuja, November. This is an opportunity to also strengthen the workforce in Africa, become competent. So thank you very much.
Thank you so much, Dr. Iyobosa. Excellent talk, very impressive. So now we have done all three talks from our speakers. We can proceed with the Q&A sessions now. May I please invite Professor Ng to moderate the Q&A session?
Yeah, thank you. I can see there's a common thread between these three continents, the three speakers have brought up. One notable is on the workforce, right? The lack of it and the migration to developed countries. And thus there's a need for capacity building. And we see that it is really evident. There's one question I would like to pose to three of you. We talk about developing phantoms. There are various projects encouraging localized, innovative phantoms, right? However, in many regulations that have been developed in somehow adopted the standards from, for example, in mammography, we have to use the ACR phantom to QC, or even CT scanner using the CAT-PHAN or the APM phantom, right? So there's really not much of opportunity to utilize, adopt the locally developed phantoms. So may I know your view on that, and how do we address these issues? Start from Hasin, please.
Thank you, Kwan, and thank you to all for a very nice presentation and to see the all regions perspective, the sustainability. Yes, because local phantom actually, if I think about the LMIC countries, everyone still would like to have the, though we have a financial constraints in LMIC countries, but they would not like to have this, use these local phantoms. As far as I understand, I go with the different administrative peoples and these things. So they would like to have more the systems which we more use in the USA, Canada, or other developed country. And all the vendors actually coming from those countries, not from the local one. So we do not, in the LMIC country, there is no innovations, there is no inventions, but we are always purchasing from the other developed countries. So now, that in many countries in the Asia, like China, so they are now producing these things. So now the LMIC countries in Asia regions would like to drive on those. That's the cheaper, but they would like to have a more corrective and more quality-based product. So they are working this going on, but we do not have so much local innovations so that we can buy the local phantoms also.
Okay, thank you. Patricia?
Yeah, thank you, Jai. Thank you, all of you. I would like to point out that as IAE members, we have resources and tools that we have put together for low and middle income countries. So, for example, this methodology for mammography and radiography is available, Chai, and it's very easy to build locally. And even though it's not a phantom that is well recognized by, for example, what I mean by recognized is that not used, for example, in the US, because they have their phantoms. These phantoms allows the medical physics to monitor quality over time, which is the consistency of the equipment. So I think that we have a lot of resources available, and I also know that the IAE is working on a similar project for CT that will come up later on. So what I would recommend is that you see tomorrow's talk that is just completely related to this methodology that Virginia will talk about it. But on my part, I mean, in Latin America, we are using this result, is functioning, is working. The purpose that we have when we propose it just goes along with what we need. So I think that we should take advantage of these available tools.
Okay, thank you. Iyobosa?
I'm sorry, I didn't get the question.
Oh, it's about we talk about phantoms, right? However, in many countries, the regulations somehow adopt the standards. Say, for example, mammography use the ACR phantom, or CT use APM phantom. So there isn't much room for local innovation. So what is your view on that?
No, I don't agree with that. There is room because even if the countries are adopting, it's one thing to adopt those things. It's another thing. What if they are not available? We cannot afford them, or we don't get the donation. Most of our equipment are donated by the IEA. How long is that going to happen? So, like I said earlier, we can fabricate these things locally and verify the science. We always compare them with this other standard, maybe the ACR one or whatever standard phantoms available, and we get the same result. So I don't see that as a problem that is not adaptable or adoptable, if I understood you clearly.
Okay, thank you. There are a couple of questions and comments coming in. Asked Prof. Yong to read them out.
Yeah, sure, Prof. Okay, we can start with one very straightforward questions. Is there a similar organizations like Doctors Without Borders for medical physicists? Anyone has any idea? Like Medical Physicists Without Borders.
Medical Physicists for World Benefits, which is Jake Van Dyke runs the organization.
Yeah, that's wonderful. There's someone shared the mpwb.org, the address in the chat box, so everyone can have a look. Great. Okay. Right. So there's some other questions. Shall I just read out, Prof?
Yeah,
Okay.
yes.
First question is to Dr. Anupama. So it's a good overview of strategy to overcome well-defined barriers. I will also recommend adding a dialogue with decision makers, such as the government's authorities, as well as vendors and educational establishment to the list. What's your view on this, Dr. Anupama?
Yeah. Thank you, Chai. Actually, the main problem is here still the most of the LMIC countries do not recognize the activities of the medical physicist. So when there is a dialogue to start a center, in that case, they will start with the administration authority and all the doctors. So there is many lackings of the infrastructures as well as the development, and they work with completely with the vendors. So this is the lacking in LMIC countries, and this has to be overcome. But I think in many countries of the Asian LMIC countries, this has been already overcome, because the medical physicists who are now established step by step with IMPCB examination, we understand that what is their role. So they are coming, going in the development committee of the government bodies, and they are now doing, because I must say, who are the participants here, they are all medical physicists. I must say, always there is a problem. When there is no problem, there is no solutions. So when the problems will come, so we have to be, we always say, because here is the Eva is a mentor, Guan is a mentor. So we need to be a leader. Otherwise, we cannot never solve these problems. We always should always in the treatment planning room, always do the dosimetry, quality assurance. In parallel, we have to think that we have to come in the advocacy, in the policy, also to do, because nobody knows actually what is our role. So this is, we can identify the problems, but there is, of course, there is a overcome solutions. I must request everyone who are the hearers, the young generation and upcoming generations, to go to this thinking that we should be in the committee, we should be in a different group to have this discussion and to know our activities and jobs. Thank you.
Yeah, that's excellent.
Chai, if I can make a comment. Anupama,
Sure.
you made a very good remark that the medical physicists need to also get themselves into positions of influence. So that they are part of the dialogue with government or decision-making bodies to be able to solve the problems. Thank you.
Thank you, Chifa.
Thank you, Anupama. There's another question from Ahmed. So what I understand, for most of the LMIC countries, treatment is centralized. Is there any ongoing efforts to decentralizing the cancer care across the LMIC? And late diagnosis causes most of the damage to patients. And can the speakers discuss about these two issues?
Oh, okay, I can speak one. Because the cancer establishment is a huge expensive things. So when we think about the decentralizing, mostly everyone is coming the capital city of any country, because they are thinking all the good doctors, all the good medical physicists, all the best one is in the capital city. It is not, especially in the LMIC country, because the government do not want to have another expensive establishment in the decentralized area, because when the problem is actually what we have seen, that's when we go to the decentralized area, only we cannot move only the manpower. The whole facilities of the manpower is related to this. That means that his families, good schools, good things, good shops, good environment, everything should be decentralized. So there should be a government. We are always asking, and on the policy and the many dialogues are going on, because decentralized is the only issue in the LMIC countries to have this decrease the mortality rate, as there's a long queue of the patients. Otherwise, all patients is coming from the, like for example, we have 68 districts. So 68 districts are coming in the one district in capital city. So you know how much the patient burden is going on. So we are now in private sector, they are now starting this establishment decentralizing. But government is started, but it is very much bureaucracy in LMIC countries. So it is taking so much time. So I think it will take too much time, but they have in mind in there that for the decentralization, but the private people is coming on, because this is a very expensive, huge setup. So who has the money and who has a good connection with the foreign donors, they are now starting for the decentralization establishment. Thank you.
Yeah, thank you, Anupama. Yeah, Patricia, you have any?
Yes, I would like to add, completely go with your thoughts. I think that government institutions are very centralized in our countries due to money constraints, and it will be hard to move them to the outside of capitals. But I think that we can maybe, as we were saying, that if we could have medical physicists in good position decisions, we can start working with private sector, because those are the ones that have the money. And for example, Costa Rica sometimes is a very tourist point for medicine. And I know that near the beach where everything is nice, they also have very nice clinics, so they can also start putting good facilities. And if there is an agreement between the country, people that live not in San Jose can also go there. But I think that it has to be a link between the private and the government to be able to move services outside the main capitals.
Can I say something? The issue of, I mentioned the issue of advocacy a lot. We need to do a lot of advocacy because we are talking about government. I don't know how long we're going to continue to wait and rely on the government. Some of the government people are clueless. They don't know what to do. I give an example of the professor in Cameroon, a medical physicist who single-handedly built a cancer center. This was not the government. He raised money through advocacy or whatever means. And I've heard a story about something like that happening in Pakistan. I have a colleague who told me about something like this 10 years ago, who raised money after his mom. I think it was a government official or a politician. So there are people that have this money. They are private individuals. They are politicians, people in our communities, local government that have it, but they don't know what to use the money for. Medical physics, we don't need to sit there and keep waiting for government, or let us go and meet these people, advocate for these centers to be built in these rural communities. And then as scientists, we can deploy artificial intelligence. Now we are having remote quality assurance, remote contouring, and all these other tools that might not necessarily require medical physicists to even be in those rural environments to deliver quality healthcare. But this is where we come in. So I'm sorry, when I hear the government, it triggers something in me because some of them are really clueless. So that is where we come in, because we know this thing. We can tell them what to do. We can tell the senator, the people with the money, what to do and help them do it. And somebody has proven that in Cameroon. He has built a cancer center in Cameroon with the only linear accelerator for the past 6 years now, delivering quality care. That's a medical physicist. We need to start to think outside the box.
Okay. Thanks very much. I think our time is up. We have over 500 attended today's session. Wonderful. And please come and join us tomorrow. Another episode on this series will be on remote and automated QC in radiology and IAEA approach. Wonderful, the three speakers. On behalf of the IOMP, Professor Yong and I like to thank you and all the active participations, and we continue with the dialogue, and that will be interesting. And last, I'd like to leave you one since Africa, remind me of the Lion King. Remember Simba returning to be the king and Buddha, right? Yeah. So think of the attitude, not to give up, to persevere, to build up the kingdom, look after a community and the rest of humanity. So thank you once again. I hope to see you tomorrow. Bye-bye.
Thank you very much.
Bye-bye.
Thank
Bye-bye.
you, everyone.
Thank you very much.
Thank you.
Thank you very much. Thank you. Bye-bye.